Okay, so we're going to be adjusting your back. Here we go. And let's go. Oh, my back. Oh, shoot. Wow.
Are you okay? Can I get someone for you?
I don't know what the hell happened. I'm so embarrassed. I'm adjusting a patient and my own back got pulled. I think I have to go get adjusted myself now. Wow. Never had this before. I guess that's what it feels like to be in pain when patients coming in. Shimla, I'll be back. I have to go see a chiropractor. Doc, you need to be adjusted as soon as possible.
How long has this been going?
Dr. Helena, how are you?
I'm fine. You are not looking so great. What's going on?
Not so great. So I was adjusting my patient.
Okay.
Did a side posture. Boom. Never happened to me. So, you know, even chiropractors need to get adjusted.
That is honest.
You
truth.
ready?
Yeah. Yeah. Okay. Take your time. Take your time.
My back.
Oh, Jesus.
Okay.
It's probably a little bit different than when you adjust, but every chiropractor is different, as we know. Okay, so drop down.
Ooh.
Good.
Oh.
Perfect. All right, so I'm going to use the arthro stem to adjust the pelvis just to break up some of those adhesions, okay? So just, you're going to feel tapping. And short chicks and side posts. All right, you can sit up for me. Take your time, don't hurt yourself. Perfect.
Okay.
All right, so sit up straight as you can. Just close your legs, touch for me. There we go. Just relaxing your head in my hands. And beautiful. Oh,
Nice.
that was satisfying.
Wow. It opened up my eyes.
See a little brighter?
All the blood flow.
Yeah.
You know, I feel amazing.
Good.
I actually can go back to, I can walk. Look at this.
Yeah.
That's amazing.
Oh, I'm happy.
Great
I'm
job.
happy I could help you.
Dr. Helena in
Elmhurst.
Elmhurst.
Yeah.
Awesome.